Hello, viewers. Welcome once again to Baraton TV, Here and Hereafter. We have been continuing our series of health topics, and today we have in studio a clinical officer from the Baraton Hospital, University of Eastern Africa, Baraton, Mr. John Chemuna Kipto. Welcome, sir.
Hello, viewers.
Thank you very much, Mr. Chemuna. We are so happy to have you because in this time of COVID-19, our community out there and even us at the university would like to hear a little bit more about this disease, COVID-19. And even though we have been listening to news, we have been, reaching out for information here and there. We feel like as a university, we are in the position and we have a hospital. We have you working there. We feel that you can tell us what are some of the symptoms of the COVID-19?
So, coronavirus disease, the common symptoms. First, the screening tools for coronavirus. One, the patient has a sore throat, fever, chest temperature more than 37.5, history of travel to areas with reported cases of coronavirus. Or if there's a history of maybe contact with a confirmed case of coronavirus disease. There are other symptoms which came recently, like loss of taste of smell.
Wow. Yes, we have heard about those symptoms, sir, and we are happy that you have reminded us again. So, what you are saying is that, like for example, right now we are in our homes. So, what should make us to be afraid? What should make us to feel maybe I should go and test for the coronavirus disease? Maybe I should seek help from a health facility.
Yeah, first indicator if you have a fever. Sore throat. Sometimes there's a general body weakness, difficulty in breathing,
Correct.
of a sudden onset.
Correct.
You should immediately put on a mask and go immediately to health facility.
Okay, thank you very much. That is true. In fact, the Ministry of Health has been giving us that advice also, and that is correct, Mr. Chemuna. Do you think it's possible that they can send, if you make a telephone call, maybe the hospital can call, can they send ambulance for a patient if we happen to have a patient in our community?
Yeah, there are measures that have been put in place by county governments. They have a toll-free number where you can dial and an ambulance will come right away to your place. With the health personnel will come to take you to a isolation center, maybe take your samples, maybe quarantine for 14 days as a wait list.
Okay, thank you, sir. We had an interview with our nurses last week, and we were thinking, in a situation where we have a lockdown. Okay, we already are under lockdown, but suppose we are unable to leave the house. You are saying that they can send an ambulance for us.
Yes.
If somebody is ill in the house, an ambulance can be sent. I think that is very, very good information for us to remember in this time of the COVID-19 disease. I want for you to please give our community some advice. What to look for, some advice, like you have told us, fever and all of that. Some advice psychologically. Okay? Should we panic? Should we be too afraid of this disease?
Okay, if one of the members develops these symptoms, the first thing is to maybe separate from the others. If there's a room, that particular patient or person stay in that room. Just wait the ambulance or the personnel to come and take him from the house.
Okay.
This is to minimize the transmission and spread of COVID-19 to the other members of the family.
Okay.
Another thing, if there's no ambulance at that time, the first thing is to, if you have a mask, you put on a mask first. And you present yourself in the hospital.
Okay. That is good advice. So viewers, you have heard him say that you can present yourself to the hospital, okay, even if no ambulance, is available to come for you. But we expect that we will have those services from the county government in Nanti County. But if in case you don't have the means to even contact, we have our hospital here on campus, and it is called the Baraton Community Health Center. You can present yourself there, and of course you put on a mask first, like he has said. You put on a mask to protect others also, and then you can be presented there at the hospital, and then they will make a decision on what to do. Or Mr. Jamuna, we have been, we know that part of the disease is respiratory distress and sometimes difficulty in breathing. Are there some things that you can do to help improve your breathing before you get to the hospital?
Okay. What I can say is that these symptoms they develop gradually. Before maybe you get to difficult breathing, maybe fever and sore throat. So those are the indicators for you to maybe seek help
Mm-hmm.
for further complications.
Mm-hmm. Okay. Very, very good. Okay, so then they will be able to help you when the correct time comes.
Yeah.
Yes. So what else do you have to tell us? In our lockdown, we have some small fear, anxiety. What advice do you have to give us in this time of COVID-19? So that is it a death sentence?
Okay, what I can say is that this COVID-19 is not worth the fear of the noise, the hype. COVID-19 is a mild respiratory infection. But nevertheless, we should practice these basic hygiene practices like hand washing. People think that hand washing is they play down on hand washing. It plays a very big role in preventing the spread and transmission. Also, putting on a mask when going to a public place, traveling on a public service vehicle.
Okay. Yes, thank you very much. You said that the COVID-19 is, many cases are mild.
Yeah.
Are there some cases that are severe and moderate also?
Yeah, there are cases. There are severe cases of COVID-19, but most of the cases they don't need a ventilator.
Mm-hmm.
Yes, it's very
Okay. Okay. So something can be done. A life can be saved from COVID-19.
Yeah.
Yet we should take it seriously.
It's very serious. It's a serious infection.
Mm-hmm.
So we should adhere to these set guidelines from the Ministry of Health and WHO.
Okay. Thank you, Mr. Chamuna. We're happy to have you in studio, and we really appreciate the advice that you have given us. And we should not fear, but we should still take the precautions given to us by the Ministry of Health and the WHO. These simple health precautions that are difficult to practice. Hand washing, wearing of face mask whenever you are going to public places, and even hand sanitizing, and ultimately staying at home. What do you think about staying at home? Should people stay at home?
Yeah, people should stay at home as much as possible.
Mm-hmm.
As long as they have no activities in public places,
Mm-hmm.
they should try as much as possible to avoid.
Yes, as you have heard the words of our clinical officer, Mr. John Chemona, stay at home as much as possible, and that is even the advice from our administration on our campus here. You should try to stay at home as much as possible to avoid spreading the disease to others, and even getting infected from the virus. So thank you once again, and Baraton TV here and hereafter. Bye bye, viewers.